Hey everyone, we're gonna give it another minute or two until we start the webinar, but there is a poll up, and we're just curious about what people's roles are in the body art world. So go ahead and take that, and then we'll get started here in another minute or two. All right, good afternoon, everyone. I'm Laurel Arizona from Pseudocol Labs, and I'm also one of the chairs of the APTO Body Art Committee. We would like to thank you for joining us for the APTO Professional Development Series. We are here today for your questions, your topics, body art regulations and innovations. And the panel includes Kay Lewis from the U.S. Food and Drug Administration, John Mysock from Pseudocol Labs, Catherine Martinez from Kent County, Michigan, Hannah Wolf, who is a tattoo artist in California, and she's also from the Science of Tattooing, Lou Rubino from World Famous Inc., Tattoo Lou's, United Inc., Ultimate Tattoo Supply, and Kurosumi Inc., and Michael Crea, who is a body piercer in Florida and from the Florida Environmental Health Association. We will be taking questions at the end of the webinar, so please feel free to hold on to your questions, or you can type them into the questions box. And at the end of the webinar, we'll open up for questions that were submitted, and we'll also open up the phone lines. So we can go ahead and get started. The first question that I have for y'all is, why are health departments requiring body art facilities to stay closed longer than other personal services? I guess, Kay, do you have anything to add to that one?
No, I don't have a comment for that.
Catherine, do you have a comment for that one?
Yeah, I just want to comment from how we handle things in Michigan. I know it's very different state to state, but in Michigan, we regulate based on county, but the state holds the licensure. So as I answer questions throughout this, kind of keep that in mind. But for us, the local health departments have no influence over what is opened and what isn't open. So with the point of that question, just kind of keep in mind that it's typically not going to be a call of your local health department. It's going to be something from the state legislative office.
And this is Sarah. So, because I also work emergency preparedness, it, like Catherine said, it really is going to depend on your state, and from, just from that emergency preparedness type world, it may be that those states that are holding off on allowing you to open feel that it's a much more intimate, if you will, type of service because you're very close. But then again, so as a hairdresser, I totally understand that side of it. And it may just be what they've talked through as far as their risk assessment on what they're willing to open at that point in time. So that's all I have.
John, do you have anything to add?
Well, I think, it's obviously maybe from a local perspective that people just don't understand the industry as well as they should. I think that's part of the reason. Okay. And I know the Body Art Education Alliance has really gone out of their way to put together some documents to help in that area. So hopefully going forward, things will improve.
Michael, do you have anything to add?
Yeah, I can chime in on this. Just like John said, uh, the states really don't know about body art facilities and body art procedures. They don't realize that a lot of the procedures that they're having put in place in a lot of these stores is stuff that the body artist has done for the past 20 years. So it really needs to be on part of the local state people where you're at to educate them and to let them know why you should be open. So that's been a big problem here in Florida too, is where the governor didn't even recognize body art or mention it in any of his executive orders. So then you had local counties just interpreting as they want, uh, as they see fit, and nobody did anything about it. And really, body artists need to get together on your state level and lobby the governor and tell them that you want to be open. These are the reasons why you should be open. And that's something that needs to be improved upon in the future. It's something that AFTO and the Body Art Education Alliance and NEHA, it's something that we're all working on together. So that next time this happens, we already have these plans in place, but nobody foresaw this coming at all. Nobody had any plans to do anything. And a lot of these governors are just, shooting from the hip. They really don't know what's going on. They're just trying to do the best that they can. And a lot of times body art is left out of any kind of executive orders.
Hannah, do you have anything to add?
Yeah, I think in California here specifically, we stayed closed for a pretty long time. Based on the work that I did with the Professional Alliance of California Tattooers and a number of other people in health departments around the state, the big issue was prolonged exposure. A tattoo procedure can take 2, 3, 10 times the amount of time that it'll take for a haircut. And I know that for us, we opened in stages. So even with hair salons, they did limit the types of procedures that could be permitted for the first tier of reopening, which is why in Alameda County, specifically where I am, they waited to open body art facilities. I think that the body art industry really does need to advocate to be included into service industries, to have a voice. Because that also seemed to be a problem here, is that we weren't specifically mentioned in reopening orders until we made a little bit of noise about it. So I think once we were excluded and we weren't specifically included, we spoke up, and then we were able to get a little bit more awareness for the industry. But yeah, it just goes hand in hand. The body art industry needs to be a little bit more active with environmental health departments in both county and state levels all across the country.
And Lou, do you have anything to add about this topic?
So yeah, just what everybody said is 100%. I think a big thing is that the education in the body art industry is not enough. I mean, we really need to educate people about our art and just make them aware of how we're working and the procedures, and we're working in a more sterile environment, I think, than a hair salon, and it should be looked at in a different way, but unfortunately that's the way some people look at us, and we just gotta continue to work on trying to educate them. I think that that's the most important part here.
Great, thanks, everyone. Our next question is, if there were a union advocating for the body art industry, how would this help influence regulation? And would regulators and lawmakers be more impersonable to a union? And I'll start with John this time.
Okay, so you want me to advocate for labor? Is that what I understand? Actually, some of the things we talked about in the previous question, it's always good to be together as a group. Now, whether it's union or whatever you call it, I think it would be a good thing, but I don't have any specifics on how to accomplish that, but I'm not against it. Okay.
Catherine, do you have anything to add?
Yeah, my comment was very similar to John's. It's the idea of a unified voice absolutely will help versus coming from a regulator standpoint. If we have 8 different shops or artists coming at us and having similar issues with certain regulations. It's a lot difficult for us to field that and to try to understand what we can do to help versus if there was just one group coming to us that we could communicate more directly with, and it would allow for more of a concise back and forth conversation on it. I don't know the union versus not union. I think it's just all about the unified voice, and the same thing for lawmakers. It would just a unified voice and having one large group coming with one consensus would, I think, be a big help. And we've seen that here in Michigan with updating our regulations as well.
Kay, do you have anything to
add? Only that on the federal level, because Congress makes the laws and regulates the laws, if it wouldn't be a union, but maybe a lobby group that could lobby your Congress people across the states that might give you that unified voice to affect regulation and law.
All right. Lou, do you have anything to add?
Sure. So I don't think, you know, I don't know if it was just not worded correctly or if just that, you know, maybe they're, I don't think that anybody would want a union, like a labor union in the tattoo industry, but I think more of standing together, united, you know, or a lobbyist group, like Kay said, would be, you know, something great for our industry. I know it's been tried a few times before, and unfortunately, it can get a little messy with politics in our industry and stuff, but everybody needs to put all that aside and remember we're after the same goal here. You know, we all, you know, love our industry, and, you know, I've been in it since, you know, my early days. My father was a tattoo artist, I'm second generation, so I would love to see this art always continue and be a, you know, strong industry. So yeah, I mean, forming a group would be something great, and you know, I think that it should be done. Absolutely.
Michael, do you have anything to add?
Yeah, I agree with Lou. It's definitely good to have a unified voice. I don't think that body artists are going to want an actual union, but having a unified voice on the state level is definitely something that needs to happen. Everybody just has to work together to make that happen and have this in place for something if something like this happens again.
Yeah, do you have anything to add?
Yeah, I think I completely agree with everybody here. The more people you can get together and the more voices you can have, the more people you can get on the same page. You know, there's power in numbers. So definitely tattooers need to have some kind of unified voice somewhere to work for a common goal.
Great, thank you guys. The next question for the panel is, as an industry, how can body artists be heard on a state level? And I'll start with Catherine this time.
I guess this would, from a regulatory perspective, again, I think it goes right back to that second question about getting a group together and hashing out what you need, and then coming to the state or to your local level, depending on what you're trying to reach, with that concise concern or question. And just, it makes it a lot easier to communicate with one person or one kind of voice. And it makes it a lot easier when you have that unification between the artists as well.
Yeah, this is their, I was just going to say, kind of coming from that same side, from the regulatory perspective, reaching out to your local artists to get them and just say, hey, let's get together in a room, you know, whether it's a meeting twice a year or something like that, but just getting everybody together, like Catherine said, to hash it out. What are the needs? And then usually, your regulators or your state NEHA affiliate or, your regional APTO affiliate can then go to your legislature if they're in session, especially if there's anything coming up that would pertain to the body art industry in your state.
All right, Kay, do you have anything to add?
No comment from me because that's all state level.
All right, John, do you have anything to add?
Well, I'll speak for Kay at the state level. I used to work at the state level. I used to be director of a state program, and the way to get things done at the state level is to work through your state legislators and know who they are, know when they meet, know when the committee meetings occur. Usually for health related issues, it's a health and welfare committee. You need to know those people by their first name, and they need to know you. That's really the way you get change to come around. Just my 2 cents.
All right, Hannah, do you have anything to add?
Not really. I think, again, with the Professional Alliance of California Tattooers, we've been trying to do that this year, is trying to get a hold of the right people and get the right people to talk to. And it has been a little difficult just to get the appropriate forum to be heard. It seems like there's a lot of disconnection in California specifically between county and state level. So this is informative to me. This is a great question. Thank you.
Lou, do you have anything to add?
Yeah, just along the lines of what everybody else said, I think that, just trying to get in touch with the legislators and, forming groups together would also help, like the previous question, and, trying to stick together and, surveys and stuff, to talk to people and, just get the word out there.
Michael, do you have anything to add?
Yeah, to piggyback on what Sarah said, a great way to get involved is through the National Environmental Health Association, or NEHA, and at their local affiliates. So, representing Florida, we have the Florida Environmental Health Association. We have a body art advisory group within our association. So if you're interested in getting involved in the state level, if you live in Florida, that's a great way to start. Most of the states also have their own environmental health association. If your state doesn't, you can get involved at the national level with NEHA or through AFTO as well, or through the BAEA.
All right, great. And this is kind of along the same lines. What steps can body artists take to get involved in local and national regulation? We'll start with industry folks on this one. So, Hannah, do you have anything to add? Or I know that all these questions are pretty similar, but
yeah, these questions are definitely pretty similar. I think we've kind of answered that. I'm not in regulation, so I think that, again, body artists kind of need to get together to have a unified voice on both a state and national level, and kind of pool to find the right people to talk to, and get some kind of similar ideals together to work toward.
all right. Michael, do you have anything to add?
That's kind of the same question as the last one, so in the interest of time, we'll just pass.
Okay. Lou?
Same here.
Okay.
Again, it is similar, but like I said before, either to have a unified voice and contact your senators and your Congress people to lobby for change in the regulations and in the law.
And Catherine, do you have anything to add?
Yeah, I just want to say that for me, when I first got into the body art industry regulation side of it, I had a lot of my local artists come to me with their concerns, and that was how I got involved with NEHA and writing the model code, and then with my state, and we've recently updated our regulations. So what I would suggest for artists is reaching out to your whoever your regulators are, if it is local, and try to start forming a relationship and a rapport with them. Because while I know I'm limited in what I can do as far as specifically going to the state and advocating for a change, but I can at least guide people to who they should talk to and help kind of construct a good letter or good wording or a good plan of how to make those changes. And I can tell you that it has worked and it has been successful, and we are still working through that process today, where it just started out as conversations with the artists, and then it turned into good working relationships, and we've made a lot of really good positive change. So start small, start local, and then use that to work your way up.
Great. And John, do you have anything to add?
Well, I think there's a lot of interest here, so my suggestion is that the Body Art Committee start a laws and regulations subcommittee just to have a place to discuss these things. Okay.
Hey,
All
Laurel,
right.
this is Sarah. Just real quick. Also, I also want to advocate for like the Alliance of Professional Tattooists and the APP. Those professional organizations, the Association of Professional Piercers, those are, the artists. Like national organizations, like we have, NEHA and AFTO. The artists also have them on their side too. So don't underestimate those groups as well.
Great. Thank you. Next question. What is happening with tattoo ink on a federal level? And I'll start with Kay.
Okay. In general, we as federal regulators are still monitoring tattoo ink manufacturers to ensure their compliance with the regulations. Our inspections have been placed on hold in light of our limited resources and having the majority of those resources being redirected to the COVID-19 pandemic. In addition, as no tattoo ink has yet been approved, approved for intradermal use, we have started color additive petition discussions with AFTO, focusing on submitting a petition for titanium oxide.
John, do you have anything to add?
Well, yeah, I can pick up on the TiO2 cap Colorado petition. We had a meeting last week with FDA, and we're starting to hone down into what kind of information we actually have to have. And I know that many of you that are on here have been on a lot of the calls. That if you want to be involved with the Colorado petition, get a hold of AFTO or NEHA or the Body Art Education Alliance folks, and we'll get you involved.
Catherine, do you have anything to add? All right. Lou, do you have anything to add?
No, not really.
Hannah?
Nope.
Michael? All right. Next question is if multiple supplies on a body artist tray are clean but not sterile, does this make sterility of every product a moot point? I'll start with Hannah.
Okay. Yes, but also no. I think that as body art professionals, being somebody who's been in the tattoo industry for almost 20 years, we definitely try our best to provide the cleanest and most sterile environment that we possibly can. There are quite a few products that we use that are not sterile. A lot of the times our gloves are not sterile, ink caps are not sterile, paper towels are not sterile, dental bibs are not sterile. However, we do try to provide everything to be as clean as we possibly can. I'm not sure that there is a way to provide a 100% sterile environment for the tattoo procedure. Maybe there is, but I think that it would be really cost prohibitive to most tattooers. So I don't think that sterility is a moot point, because definitely everything that enters the body or breaks that skin barrier does need to be sterile, like needles and inks, because you are then pushing that under the skin kind of beyond the body's barrier point. So no, I don't think that it makes sterility a moot point. I think we can always work better to have cleaner and safer products.
All right, Michael, do you have anything to add?
Yeah, I actually prepared a statement on this question, so bear with me. To answer this question, we must first remember that there is a large difference between the setups of various body art procedures. While it might be possible to have every piece of equipment sterile in a body piercing procedure, it may not be possible to have every piece of tattooing equipment sterile for a tattooing procedure. Therefore, two different infection control practices are utilized: aseptic technique and clean technique. Aseptic technique and clean technique are two closely related healthcare practices that both aim to keep people safe from infection. The aim of using aseptic technique is to eliminate germs, which are disease-causing microorganisms. Clean technique focuses on reducing the number of microorganisms in general. Every body artist should make their best effort to utilize proper aseptic technique during a body art procedure. A body piercing procedure can be almost completely sterile if proper aseptic technique procedure is followed. During a body piercing procedure, a piercer should wear sterile gloves, wear a mask, prepare the skin using an antiseptic skin prep, and sterilize every piece of equipment and jewelry that is used during the body piercing procedure. Tattooing utilizes a combination of aseptic technique and clean technique practices. Clean technique uses non-touch practices. Non-touch practices prohibit body artists from touching key parts of objects, such as needles, tubes, and cartridges, even when they're wearing gloves. While the needles, tubes, and cartridges are sterile, the tattoo machine itself is not sterile. Therefore, best efforts need to be made to prevent direct contamination of supplies and equipment. This is done through the use of barriers on the tattooing equipment. Products such as clipboard covers, machine covers, barrier film, and similar materials form a barrier between the equipment and the client and artist. So to answer your question, having some items on the body art procedure sterile and some clean does not make sterility of the non-sterile items a moot point, but rather serves to complement the sterile items in a procedure to improve the chances of performing the body art procedure as aseptic as possible. I hope that makes a little bit more sense.
I liked it.
Lou, do you have anything to add?
I didn't hear Jess, me?
Yeah.
Okay. Yeah, no, I mean, great job, Michael. That's awesome. But that pretty much says it all. We don't want to take away sterile items just because everything's not sterile. But I think that, the more that we can use that's sterile and clean, the better. So we just want to do it as safe as possible. So, maybe, just continue to use sterile items and make sure that everything's clean. As Michael said, it was a great job.
All right, John?
Yeah, I think it's important to, and Michael really pointed out, is there's a difference between things being clean and sterilizing for the purpose of removing bloodborne pathogens. Okay, that's why you have to sterilize the equipment that you reuse. Okay, but it shouldn't be sterilization and something being sterile, a sterile environment are different things. So don't confuse them, right?
Catherine, do you have anything to add?
Yeah, I like to think of it as the goal of your setup during your procedure and your area is to always be limiting the risk exposure and the potential for cross-contamination, because it is pretty impossible to have a perfectly sterile environment. You're going to have the air that's going to be contaminating, in theory, your surfaces. So the idea of perfect sterility is not really applicable and not what we're going for. The goal is to decrease any amount of contamination with every chance that you get. And that comes from each time you wash your hands to every time you touch something. So even if you have, let's say, 10 things on your tray table and 8 of them are sterile and 2 are just clean, that's still a way less likelihood of any kind of cross-contamination or pathogen exposure than if 5 of those things, or vice versa, 2 and 8. It's just about decreasing that risk of contamination with every opportunity.
Great, thanks. And Kay, do you have anything to add?
No comment from me.
All right. So next question is, are inorganic pigments removable by laser? Hannah, I'll start with you again.
Yeah, so I have a couple of slides that are included in this, and basically any pigment is removable by laser because the particle is kind of, can we get the other one first? I think it's 2B. Can we see that one? Okay, so when we look at our visible light spectrum, basically what the laser is doing is it is owning in on a certain wavelength for the particle pigment. And there are all kinds of different lasers that are available for tattoo removal that go into like different lengths within the dermal, and I did not include that one, but if anybody's curious, they can feel free to contact me, or you can get my book. So basically what the laser is doing is it's owning in on a certain color of the pigment, whether that's, you know, blue, black, purple, green, orange, yellow, and then it essentially explodes that particle underneath the skin. So if you want to go to the next slide, which is 2C, you can see that the wave-like frequency can then actually own in on the particle itself and explode that into smaller pieces, which then can be worked through the body to be removed by the lymphatic system and lymphocytes. It's kind of as part of like our body's protective process for removing toxins and debris from our system. So the compound of the pigment, whether inorganic or organic, it doesn't really matter. It more has to do with the fact that the particle resonates at a certain frequency, which provides a color that's visible in the light spectrum to us.
Lou, do you have anything to add?
After that, she killed it. No, basically just following everything she said, just all good. It doesn't really matter. It's just, you know, the pigment, you know, and the right light source, you know, like right wave. So yeah, some people think like, you know, it makes a difference on formulas and what, and you know, once the pigment's in the skin, it really doesn't make a difference on the formula. It's just the pigment there.
All right, Michael, do you have anything to add? Catherine, do you have anything to add? John?
Nope, we don't have it. Sounds good.
All right, Kay?
Nothing from me.
All right. So next question is, should testing of product for contamination only rely on what's within the pigment, or should we be looking at whether this leads directly to adverse reactions, and what should the minimum standard be for measuring adverse reaction? I'll start with John.
Oh, thanks. Okay,
You're welcome.
that sounds like a mouthful. Well, I don't have the answer to the whole question. I mean, it would depend on what the contaminant is you're talking about. Microbial contamination is one thing, and then chemical contaminants are a different thing. But yeah, I don't really have a bottom line answer for the whole thing. There's micro is pretty well, uh, it's easy to define how to control that. But when you get beyond that, that's out of my realm. Maybe some of my colleagues here can help.
Lou, do you have anything to add?
So can you restate the question?
Yeah. Should testing a product for contamination only rely on what's within the pigment, or should we be looking at whether this leads directly to adverse reactions, and what should the minimum standard be for measuring adverse reactions?
Okay. It's a little bit confusing, to be honest. So, I mean, as far as adverse reactions, you know, you got to figure out what the adverse reaction is and why it's having an adverse reaction. And, it might not relate to the pigment. It might be aftercare or how the person cares for the tattoo. That's a big part. The aftercare and, the person staying out of sunlight and not swimming and stuff like that, is very important afterwards. We've had reports of people come back and say they were having a problem with healing a tattoo, and you find out they're on the beach laying in the sun and in the sand, and it's people got to make sure that they treat that like an open wound, because that's what it is. So, and then as far as testing the pigments, we test the pigments for heavy metals and aromatic amines, and then there's the formulas that you're testing for sterility. So we do sterility testing on every single batch now. So there's a lot of different aspects of this question, but I mean, everything's got to be looked at, for sure. You just got to make sure that the pigments are sterile and everything's sterile, and then there's certain tests you could do to the pigments to figure out stability and everything. And then as far as adverse reactions, it's just healing processes and stuff like that too.
All right, great. Michael, do you have anything to add?
Yeah, as far as adverse reactions go, I know we've talked a lot about this on our APTO calls, but the FDA has a MedWatch system you can report it to. You want to gather the client's info and see what happened. Like Lou said, like what did they do? Did they go to the beach? Did they go out in the woods? Did they go mountain biking? Like you don't know what happened to that tattoo or piercing, once they left the facility. So it's always important to ask what they're doing. If you have a lot of people coming back from the same artist for black ink or red ink, you start getting 2, 3, 4 people that are coming back with the same reactions, then you can kind of narrow it down to say, okay, well, maybe it is the ink, or maybe it's something that we're doing in the tattooing procedure. Maybe it's the water that we're using to use it in our rinse cups. It can be a variety of different things. But always feel free to contact, your local environmental health association or contact one of us in the APTO committee, and we can bring it up and say, hey, somebody contacted us. They're having a reaction to ABC ink and the super duper black. Does anybody else have this problem? And, we can kind of network a little bit and ask around, does anybody have this problem? And, if nobody else is seeing the same problem, then it's probably something that the artist is doing.
All right. Hannah, do you have anything to add?
When it comes to testing, that's kind of outside of my realm, so I'll pass on this one.
Kay, do you have anything to add?
Sure. To follow up on what I think Michael said, you can always report through MedWatch. You can also report to your local FDA, and they'll take a consumer complaint or a MedWatch report. But we at FDA look at all aspects. We look at the adverse reactions. We look at microbial contamination. We evaluate some ink samples to see if there's microbes. We try and do a holistic approach to reactions to determine root cause, whether it's, I mean, sometimes it is operator error, sometimes, it's the ink itself, sometimes it's the diluent. It could be a number of different things, so we try and take that holistic approach.
All right, and Catherine, do you have anything to add? Okay. Next question. It's kind of related. So how does one determine that an adverse reaction 100% comes from the ink or pigment itself and not something else, that an artist technique, or that there was an artist technique, or that the client themselves didn't do proper aftercare? And yeah, that's the end of that one. So how does one determine that an adverse reaction comes from the ink or the artist technique or the client? And Hannah, I think you have some slides for this one, so we'll start with you.
Yes. So when I was doing research for the book that I put out, we looked a lot into like what an allergic reaction is, what an ongoing contact dermatitis reaction looks like, opposed to some kind of bacterial or viral infection. So what you're seeing on the screen right now is an ongoing dermatitis reaction to red. So basically everywhere that red was used on this tattoo is pretty inflamed, as you can see. And this client unfortunately had to have these lesions surgically removed, basically to avoid, this like constant discomfort. So usually when you see like a bacterial or viral infection in a tattoo, there will be some kind of weeping or pus coming from the tattoo because there's a live culture living in the tattoo. Whereas a dermatitis reaction usually looks like an inflamed and large reddened lesion. Something that would be like hives, or in this scenario that you see on the screen, kind of like the most extreme of an event. The other difference is that a bacterial or a viral infection happens pretty immediately after the process when the wound is still open. So it would be something that happens immediately within the healing process, whereas an allergic reaction can actually happen throughout the lifetime of the tattoo. We also have noticed that, or I say we, but dermatologists that have been doing research on ongoing skin reactions with tattoos, we have seen phenomenons and events along with autoimmune issues like psoriasis, rosacea, eczema, these types of things where the chemical reaction can react with the autoimmune disorder, or just the act of there being some kind of trauma to the dermis can cause something like a Koebner reaction, where an event like these autoimmune skin conditions tend to flare up in the area where the procedure, in this case a tattoo, has happened.
Lou, do you have anything to add?
Yeah, I mean, pretty much what Hannah said. Just, a lot of times people look at the like a bacteria infection that they want to start blaming other things, or sometimes even the artist, and it's not. It could be the fault of how they care for their tattoo, which is, it always comes back to that. A lot of times that's a big issue, is that people got to just make sure they take proper care of the tattoo, because that's the worst enemy.
Michael, do you have anything to add?
So like Lou said, just taking proper care of your body art procedure, your tattoo, your piercing, it comes a lot into play. If you don't take care of it, it's not going to heal. If you rub dirt in a fresh tattoo, it's going to get infected. Some people don't realize that, and they just think once it's there, and that's it. We're going to go to the beach, and oh, saltwater, it's clean. We'll just go there. But that's not the way it works. You know, people don't pay attention to what you give them. You can give them written instructions. You can tell them. You can put it on your website. You can email it to them, and they're still going to do the exact opposite of what you told them to do. So it's really important to make sure that they're following proper aftercare procedures, and then take it from there. If you start, you know, if the artist is having multiple problems, then it's probably not the client, it's the artist. And it could not be the ink. It could be, like I said, the water. It could be that they're not cleaning their tubes enough. If they're reusing their tubes and they're not cleaning them right, and they're pumping in, you know, old bloody material from somebody else, then people are going to get infections from it.
All right, Catherine, do you have anything to add? John?
I guess I just remind everybody the MedWatch. If you report it to MedWatch and it's happening somewhere else in the country, FDA will likely figure it out. So if it is a national issue, if it's just a local issue, your shop only, you know, then it won't show up on national level.
And this is Sarah from, you know, from the handful of, you know, people that have actually come in and complained over my career. You know, I mean, all the artists are right. 9 times out of 10, it's their aftercare. We had a guy who, you know, had a neck tattoo, had a cat sleeping right next to him. Whole family used the same bar of soap, and he wonders why it gets infected. So really talking, you know, to those people about why it's so important to follow the aftercare that that artist has given you, and it's there for a reason. You know, sometimes as a health inspector, that's what you have to do.
Okay, do you have anything to add?
Yeah, I do have a little bit. For one thing, we can't really speak in absolutes. Sometimes there's no way to know 100% whether it comes from the pigment or aftercare or something like that. But in those cases where you do have microcontamination, FDA can, and during our investigation of these things, we can identify microorganisms in tattoo inks and then link it to microorganisms found as a part of a reaction in an adverse event report. So that can give you some probability that an ink was the cause of the contamination. But that's only in some instances. You know, there are other ways, but you have to do a full investigation.
All right. Next question is, what's the difference between ink and colorant? And I'm going to start with Lou on this one.
So there's, especially in the PMU industry, there's always been a lot of confusion between pigment and ink. You know, it's all really the same thing. You know, pigment is, you know, what forms your ink. You know, it's mixed together with some additives to make the ink. But you know, it's really, you know, I think they're really just talking about the same thing. You know, I mean, you know, the PMU industry has always had this weird thing about it where they talk about pigment and ink being completely different. And I'm sorry, it's not.
John, do you have anything to add?
No, not really. I think pigment is pigment. Pigment is what brings the color to the product. So, and you add, as Lou said, you put in some additives that have various reasons for being in the product, but it's the pigment that is in your skin. That's, you know, and that's the bottom line. You can call it whatever you want.
All right, Hannah, do you have anything to add?
I do. So just to maybe rephrase this a little bit from the person asking the question, when they say colorant, maybe they mean dye. There is a difference between dye and ink. So dye is soluble in a solution. So a dye would be something that can be broken down by water or alcohol, and a pigment cannot. It's a stable compound. So I think sometimes people kind of like misdetermine like which they're looking at. And I think like in the permanent makeup industry, there have been products that are more so like on the dye spectrum, that are not as permanent as like a stable ink, like a organic polymer, something to that regard. So yes, there's a difference between dye and ink, but there's not a difference between pigment and ink.
All right. Catherine, do you have anything to add? Michael? Kate?
Yeah, I do have a little bit. Tattoo inks consist of various pigments dispersed in aqueous media such as water, alcohol, or glycerin. Pigments are the coloring component.
All right. Next question is, do all states license and regulate tattoo artists? And is FDA involved at all with regulating facilities? So I'll start with Catherine.
No, I know for us in Michigan, there are certain counties and certain departments that do individual licensing, but as a state, it is not a requirement. And like I said, we have it in Michigan where the state oversees the licensure and the local departments do the inspections. So I know that that generalized concept is quite different than how a lot of states do it. So it's so different. It is so very different from state to state and even within the state's jurisdiction and county to county.
Michael, do you have anything to add?
So every state and county could be different, and vary back and forth between having regulations for tattooing, piercing, both, branding, permanent makeups. It just depends what it is and who regulates it. If you're not regulated and you want to adhere to some sort of guidelines to make your shop, one step above everybody else, just download the NEHA model body art code and just follow that. And that's a really good starting point in place of having no local regulations. Obviously, if you have local regulations, follow those. And then you can read the NEHA model body art code. If it has more recommendations than what you're doing now, then it's always good to add than to take away from.
Kay, do you have anything to add?
I sure do. FDA works with their state and local partners whenever there is an opportunity, but in the area of tattoo artists, state and local authorities have complete jurisdiction. FDA has jurisdiction over the manufacturers of color additives and ink manufacturers and needle manufacturers.
All right, John, do you have anything to add?
No, I don't.
All right, Lou, do you have anything to add?
Yeah, most of the regulation comes from the county, usually, unless there's a full state, regulation. But you got to check with the county and your state to see what the regulations are there. And they could vary quite differently. Like I'm from Long Island, New York, and, Nassau and Suffolk County. In Long Island, we have 3 counties, Nassau, Suffolk, and New York City. And the 3 are completely different, as far as the regulations go. The only thing that's common is New York state law is 18 to be tattooed. So that was the only common thing. But just check with the local authorities first.
Hannah, do you have anything?
I think everybody's got this covered.
All right, next question is, on a past webinar, the presenter stated a lot of tattoo artists do not do the tattooing of the lip region due to the area being so easily bruised or permanently damaged. Is there any part of the lips or body that cannot be tattooed? And Michael, we'll start with you.
So being a business owner, I can tell you that the reason that the tattoo artists don't want to tattoo the lips is because a lot of it falls out half the time. So you might end up with half a tattoo, you might end up with the tattoo staying there forever, or you might end up with no tattoo in 3 days. So a lot of artists don't want to put their name on the line to tattoo something and charge somebody for something that's just going to fall out. Whereas I've seen it stay in some people, I've also seen it come out in some people. The same thing goes for the hands, the feet, doing a ring all the way around a finger. Some of the artists just don't want to deal with it. They don't want to deal with having to do touch-ups all the time. They don't want to deal with, hey, my name getting smeared for a $60 lip tattoo. It's just not worth it for them. But I have seen every single part of the body being tattooed, whether or not it heals or it stays or not. I have seen them do every single part of the body.
Hannon, do you have anything to add?
Yes, I actually have a slide for this, which I think is 22B, if you want to throw that up on the screen. Every part of the dermis can be tattooed. Physiologically, there are different reasons why ink will stick in different parts of the body. So this is a slide of basically the skin on, let's say, the palm of your hand. So that top layer, the stratum corneum, is quite a bit of dead skin cells, which tend to slough off and regrow every 4 weeks, which is why tattoos on the palms of the hands don't stay very well. Every human's physiology is a little bit different. So just genetically, some people will actually hold pigment a little bit better within their dermis. And I think, just as Michael was saying, a lot of tattooers tend to stray away from areas of the body where ink is more prone to be, to either be shed off with dead skin cells or to be moved through the lymphatic system. So on skin like your lips, anywhere that's kind of like the type of tissue that's around your mouth or genitals, the skin tends to be really thin. So there are blood vessels really close to the surface of the skin. And that tends to, when you have a lot of skin cells that arrive toward the surface of the skin, it'll move toxins and debris out of the skin faster than other parts of the body, which is why it never tends to stick really well. And yeah, lips are just notoriously difficult. And as a tattooer myself, there are parts of the body that are hard to access, that are difficult, that is uncomfortable for us to actually tattoo, that also don't heal very well, and that's why we tend to stray away from them. But no, it's not impossible. It's just not pleasant.
All right, Lou, do you have anything to add?
Yeah, just going along with Hannah and Michael, I think a lot of it just has to do with the reputation of the artist, and they don't want to put their name on something that is just in a location that has a good chance of fading or not coming out great. So, and like Hannah said too, it might be an uncomfortable position that they don't really want to tattoo. So, I mean, there's people out there that'll do it, but not everybody will.
John, do you have anything to add?
No, I don't. Thank you.
Okay.
Nothing from me.
Catherine? All right. Next question is, what can the tattoo community do to contribute to better practices from ink manufacturing? And I'll start with Lou.
I know you're going to pick me for that one. So, yeah, I mean, as far as better practices, maybe we should get some clarification on what they mean by better practices. But, we are always just trying to be a step ahead and above and, try and make the best quality products we can and follow all the regulations, and also the safest product. So, you know, we've actually grown a lot over the years, and you know, now we run under ISO 13485, you know, just to make sure our accountability is much better, and traceability of all our products and all the ingredients that go in our products. So, you know, we're doing everything that we possibly can. And I'm sure, you know, most pigment companies out there are also, you know, doing everything that they can to make the best, safest products they possibly can. But if you ever have some input or have some questions or want to ask some stuff, I mean, you could reach out to us. You know, that's no problem.
Hannah, do you have anything to add?
A little bit here. So I think as tattooers, it's definitely our responsibility to try to facilitate as safe a practice as possible. So as tattooers, it's our responsibility to buy the safest manufactured ink and the most reputable companies that we possibly can. So to work with ink manufacturers, like Lou was saying, that actually take these extra steps and these extra precautions. It's also really important to know your client, to ask the correct questions through liability release forms and pre-procedure screening, like consultations, about any types of allergies. So let's say I had heavy metal allergy, and if somebody has a known allergy to an iron oxide, a tattooer can always reach out to an ink manufacturer and ask for a material safety data sheet. Because it never hurts to just take that extra step to try and ensure the safety of clients. And I think as time progresses, the industry and the manufacturers for the industry, you know, all we can do is try to work together to bring the safest practices possible to the client.
Catherine, do you have anything to add?
Just to go off of exactly what Hannah was saying, it's on the artists themselves to do their research and to be confident in their source of their products, what they're getting it from. I know I, as a regulator, where I'm at, am limited in what I can and cannot tell you to use, and I won't go into it, but it's beyond limited. So it's really dependent on you guys to be aware of your manufacturers and who they are and if they're safe and trustworthy.
Michael, do you have anything?
We have worked through AFTO to develop a tattoo ink labeling guide, and a lot of tattoo ink manufacturers were on that call. You know, they heard what the industry wanted, and you know, they worked with us to develop a tattoo ink labeling guide that's available for everybody to use, which you can download on the AFTO website. I just think that clear and easy to read labels and knowing the ingredients of the tattoo ink is a good step to go in. But as for this question, you really need to figure out what this person means, what they want to communicate to the ink manufacturers, and then kind of take it from there.
All right, Kay, do you have anything to add?
Well, could you repeat the question, please?
Yeah. What can the tattoo community do to contribute to better practices from ink manufacturers?
Again, I agree with what everyone has said. I do think that, I'm sorry, I lost my train of thought. I think that they can definitely adhere to the labeling guide that AFTO has put out. And when they find problems with the labeling, or they can make complaints to FDA, so that we can take it from there and do an inspection and find out what's going on.
John, do you have anything to add?
I think the most important thing I gathered from what everybody said is, you know, who are you doing business with? You know, do you have a relationship with them? Or are you buying ink off on the web just because it's cheap? You know, you get what you pay for, so know who you're buying from and communicate with them when you have issues.
All right. Next question is, please clarify the FDA's role in regulating ink, dyes, and pigments. In the California Safe Body Art Act, it states body art facilities must include tattoo inks, dyes, and pigments that have not been approved by the FDA and the health consequences are unknown. So, Kay, I'll start with you. So generally, please clarify the FDA's role in regulating inks, dyes, and pigments.
Okay, inks and color additives are considered cosmetics under the law. And so FDA regulates the manufacture of tattoo inks. And the color additives are actually supposed to be pre-approved for their intended use. To date, there have been no color additives pre-approved for use in an intradermal fashion, the way you guys use them for tattoo inks, in tattoo inks. So that's basically where we come in. We regulate the tattoo inks. They are considered cosmetics under the law.
All right. John, do you have anything to add?
No, I think Kay stated it pretty well. I don't think I have anything else to add.
Catherine, do you have anything to add? Michael? Hannah? Lou? Okay. Next question is another one for regulators. So through contact tracing in Kent County, has there been evidence of COVID-19 transmission within body art facilities? So Catherine, I'll start with you.
I just actually this week with our rise in cases, this will be the last non-contact tracing thing that I'll be participating in for a little while. We're getting pulled back into that. However, I cannot speak to any relations between any positive cases and any body art facilities. It's not something, I'm sure there's a way that we could sort that out to see if there was a place of business that it was associated with. However, I can say for restaurants and any other types of facilities that we regulate, we typically are contacted to be notified that there was some sort of positive case associated to discuss how that facility should be handling their cleaning and monitoring of their staff, and I have yet to be contacted about any of my licensed body art facilities.
All right. Michael, do you have anything to add to this question?
I haven't heard of anything being contracted in a tattoo facility or body art facility.
Hannah, do you have anything to add?
I can't remember if it was an AFTO call or another call that I was on, but I believe they did trace a small outbreak to a tattoo shop in Colorado. However, I feel like, this type of thing could happen anywhere. There's really no way to be 100% on safety regarding this. If you're going to be around people, there's just a chance.
Lou, do you have anything to add?
Yeah, just the same, like Hannah said, just be extra cautious wherever you are. I mean, it doesn't matter if you're in a tattoo shop or if you're in a clothing store, and large gatherings, of course, stay away from large gatherings. Usually tattoo shops are not large gatherings, and, the artists have some space between them too. So, I don't see the tattoo shop being any more of a risk than walking into a grocery store.
All right, John, do you have anything to add?
No, I might add to what Lou said. Yeah, in a grocery store, you're going to run into maybe hundreds of people, but not in a tattoo shop. So, but yeah, I'm not aware of any that have been reported.
And Kay, do you have anything to add?
No, nothing to add.
Hey, Laurel, this is just real quick to touch on this. So here in Montana, most of our cases have been clustered. They are, like Lou said, in larger gatherings and group settings. Nothing here, though, has been really traced back to any of our body art facilities. Again, fewer numbers is just what's, I think on their side to start with. But like everybody else is saying, just protect yourself, especially if you have to go out.
All right. I am going to ask one more question, then we'll open up the phone lines, and if there aren't any questions there, I'll keep asking questions. So the next question is, what kind of training do you think is acceptable for microblading, and how do you think regulators should regulate and permit microblading? I'll start with Catherine.
So I want to fully acknowledge that permanent cosmetics and traditional tattooing, they are different. But however, in Michigan, they are put right underneath the same process. And they have to meet all of the same standards, which does make sense. But in my head, I also think of, for permanent cosmetics, more of the microblading versus the rotary pen style. And I do wish that we had a separate set of regulations to go off of for this, because when you're overlapping certain things with the traditional, that it does become very confusing, especially considering that a lot of, I would say 95% of the people that we've licensed for permanent cosmetics specifically do not have experience in tattooing or body art of any kind prior. So it can become very confusing, and it would be wonderful if the courses were regulated by some universal standard, so that way they were being taught the just basic safety precautions, including bloodborne pathogens. What I see personally a lot of is just having to discuss with artists when they're new and they come out of a class what they need to be doing differently, and just understanding that their background is not what we're used to dealing with. And I think that plays a big part in it as well, and in the need for separate regulations, and in the need for more of a oversight and ability to monitor the classes that are being taught.
Kay, do you have anything to add?
No, I don't.
Michael?
Yeah, I just want to state that through the NEHA body art group, we released a policy statement saying that microblading is a form of tattooing and should be treated by all the local jurisdictions as tattooing. So we have a policy statement on that on the NEHA website. It's available.
Hannah, do you have anything to add?
I just want to kind of reinforce what everybody else is saying, that body art is body art, and every body art professional needs to at least go through bloodborne pathogen standards of training. And I think that that can be universal across the board for anybody that's dealing in some kind of permanent or temporary with piercing, procedure on the body.
All right, John, do you have anything to add?
Yeah, I think the Body Art Education Alliance, and I hope everybody on here is familiar with. I mean, that is as a vehicle going forward would be a perfect way to get a national training standards recognition going, because it's the only place I know where we have a lot of nationally recognized people from all over the country involved in the discussion. So hopefully going forward, the Body Art Education Alliance will have another role involved in this area.
And Lou, do you have anything to add?
Sure, just following what everybody else said, I agree with them. It's just you got to get the proper training and make sure there should be some sort of training guidelines too, because everybody's doing training, especially in PMU. In the tattoo industry, it was always more of an apprenticeship. You apprentice with an artist for usually a pretty long term before you started, tattooing bodies and, tattooing, without, your apprentice watching over you. So, I think that definitely some better training is needed out there. And, just to maybe come up with some sort of, national training rules or something. I don't know. But even in Suffolk County, Long Island, where I'm from, we had the Department of Health there made tattoo artists have to practice for 1,000 hours under an apprentice, and you had to keep a book and write everything down and all the training that you did before the Board of Health would even give you the okay to do a tattoo. So besides their bloodborne pathogen course and tests that they give out. So I think that stuff like that is a great idea, and if we could get more of that going across the country, that would be awesome.
All right. Can I go ahead and open up the phone line if anyone has a question that they'd like to ask? I guess go ahead and raise your hand. I don't see any hands raised. So I'll go on to the next question. So this says for Kay mostly, but anyone can address. What is the outlook in regulating testing requirements for ink manufacturers? For instance, would USP guidelines be adapted, or would specific ICP testing guidelines be created for the industry?
Actually, there are no requirements for testing currently for ink manufacturers. The only requirement is that they have to make sure that their product is safe for the intended use and is labeled appropriately. So any testing that they do is in the realm of making the product quote unquote safe. So but there's no actual regulations that says you have to do microbial testing, you have to do sterilization testing, no gamma radiation testing. There's no regulation that says that. It just says that you have to make sure that your product is safe and labeled properly.
John, do you have anything to add?
Actually, no. I think she said it pretty well. I mean, yeah, obviously FDA does testing, and they follow their what they call BAM 23, which is the same for cosmetics. But I also think, and maybe Kate can clarify, I'm pretty sure that they have a statement that they should be sterile. Ink should be sterile when it's manufactured. But like Kay said, there's no regulation that states that. It's just part of the safety, being safe for use, for tattoos.
Right, and I'm not exactly sure that we've made that policy statement about the inks being sterile yet. I know we've had internal discussions, but I'm not sure that that's public yet.
Lou, do you have anything to add?
Yeah. So again, we should be, following GMPs, and doing some self-regulations within our company. That's what we do. Like I stated before, we're running under ISO 13485, giving ourselves accountability and processes in case there ever was a recall and everything. It's all documented, and we're keeping track of any complaints or anything. And also have traceability on all our ingredients. So, if there ever was a problem, we could trace it back to any ingredient that's in it. And also, we're testing all the raw material, and we're actually doing microbial testing on the raw materials before we even process the inks. And then we're, after manufacturing it, we're testing again, doing microbial testings on the final product once it's bottled and complete. And also sending out for gamma radiation, just to ensure everything's 100%. So there's no, we're taking all the extra steps that we possibly can, just to be sure that our product is safe.
All right. Catherine, Hannah, or Michael, do y'all have anything to add? All right. I think that somebody raised their hand.
Hi, Laurel. Yes, we do have a hand raised. Dana, I am going to unmute you. If you would like to ask your question, you might need to unmute yourself, but go ahead and ask your question.
Hi, can you hear me?
Yes, we can hear you.
I know we've been talking about tattooing. I was just wondering if anyone can speak on gun piercing and what regulations are being put into place regarding that. I know I'm from Sarasota County, so I'm wondering if you might be able.
Yeah, I'll chime in on that. So the state of Florida doesn't regulate ear piercing guns. In fact, it specifically calls out that body piercing, in the definition of body piercing, it says that piercing the outer rim of the ear, whether you're using a needle or a mechanized ear piercing gun, is not considered a body piercing in the state of Florida. And a lot of other states are like that as well. So what NEHA did is, we developed a policy statement regarding ear piercing guns. Basically, we said that ear piercing guns and the people that are using them, the facilities that use them, should be regulated as a body piercing establishment. Now, it's just a policy statement from NEHA. It's not actual law, but at least we do have something out there that says, the majority of the industry thinks that places that use ear piercing guns should be regulated the same way as a body art establishment that uses needles.
Great, thank you, Michael. We do have another hand raised, unless anybody else has anything to add to that. I'm sorry, does anyone else have anything to add?
So one more thing, the ear piercing gun, when according to the state law, it's only used for the outer rim of the ear. That doesn't mean that you can start piercing noses and lips with that. So we've seen some places like here in the malls where they decide, oh, we can use the ear piercing gun, so let's just try and pierce a nose, and let's just try and pierce a lip. And the county fair comes to town, and we see atrocities for the couple weeks that they're here, where they're just piercing every part of the body with an ear piercing gun. So the law doesn't exclude that. Like you're only allowed to pierce the outer rim of the ear, and if they're doing any other part of the body, you should report them to the local county health department.
In Michigan, our regulations and our law, they define in the definition of piercing, it actually says except for the ear. So we don't specifically talk about that type of equipment, but we exclude the ear. And that kind of was the roundabout for not dealing with the ear piercing guns.
And in Montana, you're actually only allowed to use it on the lobes. You're not even allowed to use it on cartilage.
So I think this is a real important discussion that industry needs to have with regulators, and why you need to be involved with your local environmental health association is because when these laws come up for review and we're having these phone calls and trying to update all the laws and regulations, you're going to have lawyers from the companies that manufacture these ear piercing guns on the phones with us. So if there's 20 lawyers and one body artist, well, guess who's going to win that conversation? But if you have 30 people from industry that are standing up and saying, no, we don't want these ear piercing guns to be allowed. These are the reasons why, A, B, C, and D, and they only have a couple of lawyers on, trying to fight you on it, you're going to have a pretty even battlegrounds. But when the lawyers are overwhelming the body artists and there's nobody getting together and lobbying to outlaw the piercing guns, and that's why you have these little exceptions in the rules.
All right, well, thank you for all of those responses. We do have one more hand raised. So Cassandra, I am going to unmute you. You may have to unmute yourself to ask your question, but I'm going to unmute you and feel free to ask your question. Cassandra, are you going to ask your question? Okay, it seems like Cassandra might be having audio issues. Laurel, if you would like to ask another question from the question box, we can take one more, and then I think we might need to start wrapping things up.
All right, can someone discuss the glow and the dark ink being used, and then also fluorescent inks? Does it seem to hold its color long term? Lou, do you want to start with that one?
I really didn't hear the question well. What was the question?
They're just wanting someone to discuss fluorescent inks and dark inks with glow in it being used.
Dark inks? I'm still not understanding.
I'll go to another one.
Somebody
Laurel,
else.
is that question about the glow in the dark ink?
I guess so.
Blacklight ink, I think.
Oh,
Yeah, I
blacklight
think so.
ink.
Yeah.
Yeah, some manufacturers make blacklight ink, others don't. So it's another form of pigment. I don't really have information on it.
Does anybody have any information? Have anything to add on that? Hannah, do you have anything?
I mean, to my knowledge, it's not safe for use in humans because it doesn't adhere to the less than 1 part per million of a known carcinogen. I think it's relatively more on the toxic end. If my understanding is correct, and maybe Kay can elaborate this if she knows the answer, I believe that the blacklight ink was approved for use in livestock, but not in humans, and that's why it's available to the public.
I don't know the answer to that, but if it were approved for use in humans, it would be listed in the Code of Federal Regulations, Part 82, I believe.
John, do you have anything, or Catherine?
Not specifically, but I'd say don't use it. Okay, that's my suggestion.
All right. Well, it is 2:30 Central Time, so we have to wrap up. There were a lot of questions that are still coming in, and so we can pull together another webinar sometime at the beginning of next year. So please, if you have any questions for anybody on this panel or anything related to body art, you can send them to Amy or me, and we'll put another webinar together. Thank you all for being here. And this was being recorded, and we will distribute that as soon as it's ready. So thank you all, and I hope you all have a great Monday.
Thanks, everyone.
Thank you.
Thanks.
Thank you, everyone.
Thank you, guys.
Yeah.